I'm sure some of you are just here because you want to know what Imagineering means. Because you saw that and you're like, Imagineering? I've never had that. But this is a serious conference. You can't just say imagining. It would not be serious enough. So Andrew and his people had to say Imagineering. So Imagineering is a portmanteau which combines imagining and engineering. Oh. Excellent. We're on the same page. So what we're trying to Imagineer tonight is, you all remember baby Saturn Osanya, right? He had a bullet stuck in his head. And he was here in Mombasa. He had to be transported to Nairobi because the best neurosurgeon he could find in the country, well, one of the only neurosurgeons in the country, was in Nairobi. And perhaps that's emblematic of everything that's wrong and broken with the health system. Over the last 2 fireside chats that I've had occasion to be at SAP and Orange, something did come up a lot again. That was the laptops project the government is doing and the impact it could have on education, but also the drama around it, not just about the tendering, but whether we actually do need these laptops as well. So we do agree. Those are details. What we're trying to achieve is, can we get people decent healthcare? Can we get people decent education and education that can take them places? Well, how you deliver that and the nuts and bolts and the bells and whistles related to that are details.
I want to start by stating his challenge. Mr. Njoka is responsible for the training of about 60,000 or more health workers, say doctors, nurses who work in our public hospitals. Obviously, some of that role has been taken up by the counties, but how do you do that fast and cost effectively to make sure that they have the skills and knowledge that are required of them so that they can manage patients, and without, for example, disrupting service delivery. Because as you'll realize, some of the facilities in Kenya are actually manned by just one health worker, usually a nurse. So, for example, what Mr. Njoka is currently doing is what they call the induction of health workers. Basically, when a health worker is employed, but before they are deployed, they are required to take a course that gives them material on how the government works, the new structure of government, the new devolved structure on government, what are the processes, what are the procedures, ethics, communication in government. So how does he do that for, say, when several thousand workers are recruited and quickly? Initially, they used to do this in hotels over 5 days, where they'd bring in the health workers, remembering some of those facilities are manned by one person, which means that they had to close the facility when they were attending that training. So they could do that over 5 days. That was not only expensive, but very inefficient. IntraHealth, together with the Ministry of Health, were able to reduce that period to 2 days and supplement it with an e-learning module. But again, that was it was at least 50% cheaper to do it that way. However, the costs were still too high, accommodation and everything else. So what he is doing right now is being able to develop a new e-learning module that takes into account the new structure of government and offer that course to newly recruited health workers once they are employed, but before they are deployed. That way, the health workers, the government does not incur any direct costs at training them. And two, we all know that if you're looking for a job, you'll do anything to get that job. You can also start charging for that course. So out of the charges, and they can get money to either review the course or to manage the infrastructure part of the course. So I think this is just a very strong proposition for the value of e-learning, and we are doing that not only with the Ministry of Health, but also with the Kenya Medical Training College, which trains, I think, about 80% of the health workforce in this country. A simple statistic, out of the about 25,000 applications that the Kenya Medical Training College receives, they're only able to admit 6,000 students. So what happens to 19,000? So we're also trying to help the KMTC to come up with e-learning programs that will also help them expand admission capacity. And not only that, each student, when they join, they get either a tablet or a laptop that they can pay through their fees over the duration of the course. So what that does is that the student has a laptop, which they also carry with them into employment. And in future, it can be used also to now give them the training that they require on a day-to-day basis. So that is his challenge, and I'd also be happy to know what the private sector and the rest of you feel, or new models that would make it better and easier to basically deliver that training, that crucial training, to the health workforce.
We at Microsoft have some evidence, with regards to what we've been doing in the healthcare segment. I'm not a health practitioner, neither am I an educationist, but we basically are enablers. We try to enable these segments grow and add value, within the country. I have a presentation. I'm not sure whether that's up. I was going to show, some of the work that we're doing with one of the partners that won an award earlier on today, Microclinics Technologies, and basically show some of the challenges that we're facing in this space. Basically, in the healthcare sector, the big question really is around how do you monitor communicable diseases? How do you track and how do you deal with the flow of drugs, across the country? Those are real big concerns, that is being faced today in Kenya. It's a real social scourge, that needs to be dealt with. And we've worked with one of our partners, around, trying to address this solution or this challenge, through some technology solutions that our partner has developed, supported by Microsoft. And I was going to share that with you around how we're trying to address, this issue in Kenya. So basically, some of the challenges that we see, just in engagement with organizations like KEMSA, around drug distribution through the counties, is that you have about 6,000 health centers, across the 47 counties in Kenya today. And the biggest challenge here is more around the fact that there are lots of manual processes going on. You can see that there are about 18 plus registers that is used to track information daily, okay? In each of the facilities. So that's a big concern. How do you address those type of things? Because there really clearly is, administrative burdens, especially for the health workers. How do you address those type of issues? There certainly duplication of efforts, and of course a lot of wastage, that happens. I think the numbers basically is around $50 million, that is wasted, administrative issues, today. So we've basically looked at, this solution, and they say a picture tells more than 1,000 words, okay? So just imagine this person who, in the hinterland, who basically has to go out there and look for drugs. That's a real life situation and a social issue that we're dealing with in Kenya today. So this person is basically has seen the doctor, has engaged with the doctor, is basically trying to get, some drugs, for some health concerns that she probably has. And what we're trying to do is basically use some form of handheld device and some form of technology, okay? I don't want to mention the type, but it's more around trying to ensure that the data, the service data, is gotten real time for personnel management, financial reporting, the drug distribution, and all of that is basically gotten through this process. So what we've done is that we've built this dashboard where KEMSA will be able to monitor what goes on part-time, okay, real time. So they know exactly, do we have an overstocking issue? Do we have an understocking issue? Okay, how do we ensure that the drug that is going to Kisumu, is not expired? How do you ensure that the drugs that is going to Kisumu is actually the right type of drug that is required in that location? So this system basically helps manage that process real time, and that's some of the things that we're doing in collaboration with KEMSA, microclinics who the ISVs that have developed this solution, and we believe that it will really help address, some of these challenges in this space. There's a small video I need to show. Can we have the
Vision
volume?
of medicine. Proper management of these drugs is necessary so as to ensure healthcare accessibility for all.
A health application is very important. The one we've developed is called ZD, which stands for Zidisha, means go above and beyond. And the reason for having that application came out of extensive research we did in the rural health facilities. And we observed that the health workers are micro enterprises like mom and pop shops, corner stores. And they need to be efficient. And in order to be efficient, they need support. And the question became, how can we help them?
ZD, a healthcare mobile application, was developed to improve monitoring and evaluation in healthcare facilities through tracking patient data and medical stock.
Our solution allows a health worker to document the patient encounter, and then as they're seeing the patient, they're going through a standard workflow. So it improves the quality of care. There's nothing like having a mother saying, oh wow, you're asking me all these questions, and then she feels like, wow, you're taking care of me. It standardizes care, improves the quality of care. But then also, it auto-generates, ZD auto-generates the reports. As the reports are generated, the nurse is able to make decisions.
Okay, I think you get the point. So basically, this helps just manages the flow of drugs, within the country.
Allow me to share with you my true story. In compliance with Article 230 of the Constitution and the Salaries and Remuneration Act 2011, I was shortlisted to represent the Senate in the SRC, among another 32 Kenyans. I was the youngest candidate at age 41. I'm glad you find it humorous. Immediately, I was ushered into the interview room, and of course, one of the first things that I did was to open my laptop bag and remove my laptop, just like I've done, and basically access the contents, and everything was just on the desktop, just waiting. The chair of the Parliamentary Service Commission, looked at me a bit puzzled, and the room was silent. And the question was, why do you need a laptop? Why have you come with a laptop? And I tried to explain that this is a tool that I use, and I said, okay, could you please step out? And we need to consult, and we'll call you back. And that's what I did. And for the next 15 minutes, I was out there wondering what next. And when I came back, the decision was final. The parliamentary standing orders do not allow digital devices. And as such, I could not use the laptop.
You need to say that again.
The parliamentary standing orders do not allow digital devices in the House. And this was a parliamentary session. Remember, I was seeking to represent the Senate. Consequently, I could not use a laptop. I was the youngest, remember? And one of the things that also came out, and he pointed out, out of all the candidates we have interviewed, and I was one of the last, you're the only one who has come here with a laptop. 70% of Kenya is below 35 years. 32 million Kenyans below 35 years. 42% of Kenya, that's an estimated 18 million, as per our last census, is actually below the age of 15. So do we have a demographic divide? I'm persuaded that we do. The lady you see with that camera, age 6 years of age, by the time I took the photo, is already digitalized. She will be the next civil servant in another 18 years, working in the national government or working in the county governments. She will be seeking services, public services, and I'm sure that we cannot afford to allow those services to be the kind of services that were offered to her father and her grandfather. The lady that you see ahead of you, in front of you, is actually the proverbial Wanjiko's granddaughter or great-granddaughter. And there, she belongs in an age group that I would call Generation Y, that are basically around 20 million. In fact, in excess, around right now heading to around 50%. So I'm wondering, when we are passing laws, when we are enacting regulations and drafting policies, are we thinking about these people? Because they are very different. In fact, one of them is just sitting behind me. Larry. They're so different that they receive calls using their watches. I'm serious. They receive calls, use the, and the priorities. You're looking at a generation that is very knowledgeable, highly impatient, service-seeking, and will definitely not entertain status quo. If this doesn't move us, I wonder what else will. So is the civil service ready for her? Is she going to be spending 24 hours a week on traffic jams? Yeah, we spend an entire day a week on traffic jams in Nairobi. Is that what we're going to subject her to? By the time she's working in the civil service, will teleworking be part of the culture so she can be able to work from home and take care of, have more time with her children? Will she enjoy 6 months of maternity leave like her colleagues in the UN? Why not? We need to seek alternative engagement models. I was hoping the PS was going to be here because I'm not very sure what plans have been put in government as far as succession planning is concerned, so that we can start handing over the mantle to Generation Y and Generation Z. And my question to my PS was going to be how we can position Larry Madowo to sit on the ICTA board in another 5 years. Because these are the guys we need to start moving forward. Sorry, Larry. Keep on doing it.
Here, here.
The Jubilee government is very determined in its way forward from a manifesto perspective, but also from the midterm plans of Vision 2030. By the year 2017, in the education sector, we will see early childhood development education resource centers in every county. Let me not even talk about the laptop program. But yes, there will also be electronic MIS centers in every county. Governance is an issue. And every flag, project that I've basically made visible to you is ICT driven. In the health sector, as part of what the government has planned, Moi Referral Hospital will be modernized, and so will Kenyatta. We're looking at another 58 e-help centers around the country. He talked about reengineering, on the HR for health. But here's my question. Why 2017? Why not 2015? Is it because it's public sector? That's why it takes so long to execute? Is it because it has to be under the PPP regime? So we think. Why do things go so slowly? Because I'm thinking, with increasing broadband penetration through the entire country, with the disruptive technologies that are taking place from a trend perspective, that we in the public sector and you in public sector have well knowledge of, with a young Kenya in excess of 32 million being under 35 years, I'm wondering, why can't we do this by 2015? So allow me to quote controversy. Forget CapEx. Forget capital expenditure. County governments, national governments, reconsider alternative models. Leasing, PPP. Let's be creative. Let's get solutions. Let's move. Let's accelerate. Let's make things happen. Forget CapEx. It's taking, what, 6 to 9 months to get a project from close actually to 15 months from design all the way to implementation. My governor in Nairobi, and I'm glad that my ICT minister, Mohammed, where are you? Ah, yes, my ICT minister is here. I came prepared politically as well. But my governor in Nairobi is about to deliver transport services using 200 buses to the citizens of Nairobi County. And there was no tender.
All right, this sounds like a dangerous proposition.
But think about it. And I know Dr. Rono is here. We've just had a word with him in terms of PPP. But let's think about it. All I'm saying, let's be creative within the framework of the law, and let's get these things happen.
So let's bypass procurement regulations and just get things done?
Negative. Leasing, and Dr. Rono will tell you, is part of the game, and it's a legal scenario. But here's another one. For a long time, and I'm guilty of this, Service providers in the ICT and industries have been engaged in models of coming, delivering boxes, and walking away, not caring what the programmed results are going to be. So here's my appeal to you in the public sector. Ensure that you have mechanisms where service providers like Dimension Data and whoever else are part of sharing the operational risks. They need to deliver through and through, not just boxes, but services, and be part of the results.
Okay.
But lastly, and that may mean managed service, you know what, let's forget about titles. Let's get it happen. These guys just can't deliver boxes. You have specific results that you have targeted when you are asking technology to be employed. And your service providers must be accountable to deliver those results beyond technology. If that had happened, I don't think we'd have had the crisis with IEBC in the last general election. But here's my last one. Make it happen in 3 weeks, not 3 months. We can't afford to wait. So let's break barriers from a time perspective. Let's understand that we are leaders in this nation of 32 people that we need to basically prepare Kenya for as a platform for them to basically be able to come and move into much higher levels. And I don't think we have the time.
We seem to have a pretty good idea of what exactly is the problem in health and education, but we're still doing the talking and not the action. At least there's something that's to a certain degree Microsoft and IntraHealth are doing. But what is really that game changer, that disruptive thing that will make sure Rwanda, for instance, is 80%, over 80% health insurance, even to the poorest of the people, near universal education. The poorer than we are, the smaller than we are, in all ways, the odds are against them.
I think one of the things that we need to do, particularly in health and education, is basically look at, new models. Technology today has presented that opportunity for us to look at that, move from CapEx to OpEx. That's an interesting one. We've had various conversations, around, how do you think about service delivery, in our country, and we really feel that, in my view, that the cloud service, is one way we could use to deal with some of the challenges that we face, in our markets. We need to accelerate. There seems to be a clear access aspiration. The question and the challenge that we face, is really more around, the deployment dilemma. That's what I will call it, and we need to overcome that,
Okay.
So I agree with my colleague, around the fact that acceleration, execution is what we need to do, but it needs to be within the boundaries, of the law,
All right.
So that's basically my 2 cents on this one.
I think for us, especially on the training front, is mainly what we're trying to do is actually to ensure that the enforcement of rules and regulations, especially in regard to the professional bodies that are, say, the Nursing Council of Kenya, to a point where health workers can begin to demand for continuing training, and through that demand, then they can approach. It's a good business. It's a good value proposition for training institutions to offer the courses that they need. So, basically, for health workers, reg bodies to be able to enforce the rules, so that you cannot practice if you do not attend several hours of training.
And that guarantees us that the quality of the service, the quality of the healthcare we get is of a proper standard.
Definitely.
All right. Benson.
I think we have an attitude problem.
How so?
I think we think African.
Hang on. What does that we think African mean?
Exactly that. We are African. We are content with being African. Let me put it this way.
Are you guys going to stand for that? All right.
Let me put it this way. The United Nations has 4 offices around the world: New York, Geneva, Vienna, Nairobi. So how can we even think African? Our standards are not African, should not be African. You know, Nairobi is the capital city of sub-Saharan Africa. I think we need to be bold and basically say, if it's never been done before, if it's in Africa, if it's an engagement that has never been done before, but it makes sense, you know what? We're going to do it, and we're going to deliver those services that our citizens need.
So we think small scale.
Let's not go there. We think African. I think we need to redefine Africa again. We need to be the lions. We need to be bold. We need to do these things. And we need to stop beating ourselves. I think we need to trust ourselves. We need to trust our systems and basically make services happen. Again, it's not about technology.
All right.
More a reflection as opposed to a question. I think dissatisfaction with the status quo is a good thing.
But we've been dissatisfied with the status quo for 50 years.
Maybe, and maybe not. Speaking about it and acting on the dissatisfaction is a different ballgame. But I think there is always a tension between execution, and transparency, accountability. Does public sector bureaucracy serve a useful function? And I think this perhaps is one of those key considerations that we must be alive to when we are thinking about accelerating the pace of service delivery. So ICT provides very useful opportunities and wonderful innovations in terms of solving some of these problems. But to what extent can some of those systems be circumvented? I think there is some food for thought there.
I can think of a single reason, a single instance where public service bureaucracy would serve a good cause.
As we think about accelerating, and I want to agree with Mr. Karanja, let us also think about the dichotomy of development in this country. That for that girl with a camera who is already digital, there are 5 like her in other parts of this country herding goats and have never seen a laptop, leave alone gone digital. So we must think with all these Kenyans in mind. And if we are not redressing that dichotomy, that as we are today, my children and Mr. Karanja's children are in the first world. At age 5, they own iPads. But what about those other children who are almost at the level of hunter-gatherers? And I think that is why, as planners of development, we must deal with those 2 groups and create a level playing ground for all of them and deliver services to them.
And what, Mr. Kihara, and what is the problem? The fact that some live in the first world and some at the level in the same country of hunter-gatherers. Yes. There's obviously a big problem here.
I agree with you.
One of actually the things that we should be thinking about from the ICT perspective is to look at how ICT can support agriculture. Because evidence has shown that except for 2 island nations, which is Singapore and Hong Kong, development starts with dealing with agriculture. And that is where over 84% of our people are supported, including all those hunter-gatherers. So, relating to what we've been discussing today and yesterday, I want to persuade us to devote more attention and time to how ICT can support agriculture.
I think the challenge is on us, all of us attending this meeting, to begin to change perspective and look at ICT as a tool for economic and social development. That is where the starting point is not necessarily agriculture. There's a lot that various players, both application service providers and network operators, hardware developers, can all do working together to address some of the problems that we are experiencing in this country. And the biggest challenge, sometimes to getting that done, and to answer the question that Larry was asking the Office of the President, is we are not having in place the right policy framework to facilitate the deployment of ICT as a tool.
Fiona, I am a journalist, which means I'm a skeptic. What are you saying exactly in English? Because I have a problem. The government people tend to say very nice things, which don't translate into actual tangible work.
We need to create the right regulations, the right policies that create the right environment to enable those who have invested in ICT businesses to be able to get into those regions where we have the hunter and gatherer kids and transform their lives using ICT, and not necessarily coming in first to do water and housing and the basic needs, because we could also deploy ICT, and that ICT facilitates the donor agencies to come in and facilitate other socioeconomic issues.
So I agree with the regulations and I agree with the policies. I think those things needs to be in place. I just want to give a small example of an experience, where I think, ICT has supported the agriculture sector specifically. I come from West Africa, Nigeria, and I was privileged to be close to the Minister of Agriculture, who was formerly here in Kenya. He was actually supposed to be part of this event, and one of the things he did 2 years ago, when he became the Minister for Agriculture, was he found out that 11% of the fertilizer that was being imported got to the farmers. Only 11% of what was imported. So there was huge corruption in that space, and one of the things he decided to do was basically say no more contracts from the government to no more importation of fertilizers by the government in Nigeria. He basically wanted to move that. He moved that out to the private sector. Now, what that did, and he now introduced technology from a mobile voucher point of view. So he basically did a survey, registered all farmers in the country that had mobile phones, and gave and got a solution, called a solution based on a voucher system that enabled the farmers get short codes that allowed them get fertilizers at subsidized rates.
All right.
So basically, that helped improve the yield by up to 40-50%. Local yield. So and the impact of that today, agriculture in Nigeria contributes about 45% to the GDP of that country. So I think that is one area where ICT has really been able to support, in terms of service delivery into a country.
This is what I carried with me from nursery all the way to university, and I'm carrying it even now. This is what the laptop for students is replacing. The laptop is a bug. The books are content in their mother tongue, in their context. Why would you want to teach a child in Wajir A is for apple? They've never seen an apple. Okay? So you need to contextualize the content. That content is available today in Kenya Institute of Curricular Development. The systems are in place.
Which apple are you referring to?
And we're talking about national. Okay? And we're talking about a national scenario. So ICT, so think about it from that perspective. ICT for agriculture, roll out the Huduma Center to every chief's office on a broadband connection.
Okay.
Make sure there's a video room that can accommodate farmers. The farmers will go to the chief's camp on a predetermined day.
All right.
Content will be delivered from Kari to that particular area, focusing on the crops of that area, and there will be training. Systems are in place. Due diligence, Dr. Rono, Absolutely. Due diligence has to be there. I work for a company that basically whose revenue is into $200 billion per year, annually. They will not engage on any PPP in absence of due diligence.
Okay.
There's no shareholder value. It's risking the money. Yeah? So, of course, due diligence has to take place. But by all means, let's accelerate it. Let's be creative in accelerating it.
All right. Very well done.
I think I'll just make two comments. One, I think I don't entirely agree with the policy issue, because sometimes no policy is also a policy. It means that you can basically just hit the ground and do what you want to do. The policy will follow.
What is that? Are you just generally guessing?
No, I'm just
or making it along as you go along?
Yes.
Okay.
Policy can follow. I mean, potentially for M-Pesa may not be here with us if we started developing policy. Secondly, there's no shortage of technology solutions, whether in agriculture or health. There are lots of solutions actually looking for a problem to solve. And that is definitely not the way to go. So you start with the computer, then you go and look for what do I do with this solution. So I think we need to go back to basics. Basically, problem definition. What is the problem we are trying to solve, and how can we solve it? Sometimes the solution does not lie in tech.
I think on the legal regime, we need to look at the way the private sector operates and the way the public sector operates. If I want something in the public sector to buy a pen, I take 3 weeks. Does the private sector take 3 weeks to get a pen?
Of course not.
It tells you there's some walls we need to sort out. Because those laws was put in place to help a problem then. Is that problem still persistent today?
So what is your point, sir?
We need some comment probably on other overriding factors that are impeding service delivery.
I would have suggested we use ICT as a tool to help the former marginalized regions. Why am I saying the former? Because devolution has really helped us now. We are no longer marginalized, but we want ICT now used to tell other Kenyans that we are Kenyans just like them. If you talk of Mandera, in fact, we say, although devolution has helped us, we say Mandera should have been the county #1, because for those of us who did history in school, the border point 1 of Kenya is in Mandera. But we were given #9, okay, we are okay. Now
you're still in the top 10, so I guess that's good enough.
Okay, why am I saying devolution? I mean, ICT should be used as a tool to help the former marginalized counties, because what is with all the Kenyans today, any ministry I go, any organization that I visit today, when I talk about Mandera, the person will tell you first, Mandera, where? They pick only security-related issues.
Okay.
So what we are saying is that they should be, a task force should be formed to redress all the wrongs that were committed the last 50 years.
All right.
So where am I coming to?
Your point, sir. Make your point.
Yes, where am I coming to? To tell Kenyans exactly there is everywhere, because soon we'll be getting Kenyans in Mandera because we are discovering now oil. So before it's too late, ICT should be used as a tool to at least help the former marginalized counties.
Well done. Please give them all a round of applause. Thank you for your contributions. And please give an even bigger round of applause to my panelists, Kunle Awosika, Benson Karanja, and to Martin Kinyua.